guys, it's Khaki. 8 weeks ago, I had a extended arm lift with the axillary chest wall extension as well as an extended tummy tuck. And I'm going to talk to you today about how I'm doing. I have been doing really well. I am, as if you watched my earlier videos right after my surgery, you know that I went through some massive swelling. That has resolved, I'm very happy to say. As far as my tummy, in the afternoons, in the evenings, I do still have quite a bit of swelling. Start out the day more flat. It's still not, it's not flat, but start out the day more flat. By the evening, I'm a little bit more round. You can definitely tell I'm swelling in the evening, but from what I'm reading, that is absolutely normal and happens for up to a year. So I think I'm where I should be. Good news is I was given the clearance to start yoga again by my plastic surgeon. I've been doing that for a couple of weeks. Oh gosh, you can really tell when I do yoga the tightness. Of course, I did have the muscle repair in my abdomen. When I do those stretches, I can feel it. Also, the tightness in my arms as well. Didn't have any muscle repair there, but you can just tell the tightness in the skin. I have been able to stop wearing my arm compression. My doctor really wanted me to wear it for about a month, said after that it was a comfort issue. So, I feel fine without it. Every now and then, if I feel like my arms are a little swollen, I'll wear my arm compression at night. But on a day to day basis, I'm not wearing it. I do still wear, as far as the tummy, during the day, I'm wearing kind of like Spanx, like a high waisted Spanx. Then at night, I'm wearing still an abdominal binder when I sleep. That may be the reason my tummy's so flat in the morning, but I think that, from reading everybody else's experiences, that's pretty typical. I am going to insert videos here. I'm first going to put my before that were made the night before surgery, so to kind of refresh your memory on what I looked like. Then I'm going to do one from this week so you can see where I'm at in 8 weeks. Okay, so this is your quintessential in the bathroom pic. I don't know any other way to do it except in the mirror. So I'm going to talk about my arms first. As you can see, I have a lot of loose skin on my arms on both sides. You can see that. I'll kind of lift them both up. So with the arm lift, it will all this extra stuff, it's going to start up in the armpit area and then go down to the elbow. You do have a pretty considerable scar, but it's not visible when your arms are up against your body. I mean, if you're raising your arms up, you will be able to see it, but I doubt I'll be doing that very, very often. Okay, guys, it has been 8 weeks since I had my extended arm lift with the axillary extension and my tummy tuck. So I'm just going to show you what my scars look like now. So first the arms. As you can see, my incisions go all the way down to the bottom of what would be a traditional bra line. I have since found out that this is called an extended arm lift with an axillary chest wall extension. Normally, a arm lift stops in the armpit or axilla, but mine extended all the way down, just due to the way that my skin and fat distribution. As you can see on the left side, the scars are, especially in the axilla, are more raised and more noticeable. But these are going to fade. I am applying scar tape and silicone scar gel, which I'll talk about how I do that. But overall, I think they look great. How often are you going to be walking around like this? when I have on short sleeves at this point, and these scars, like I said, are gonna fade. They take up to a year to fully fade to what they're going to be and heal. So I am hoping to get a little bit more fading in the axillary area, especially on that left side, but I am thrilled to death with the way that it looks. Okay, so now talking about the abdomen, I'm going to step a little bit back. As you can see, I have quite a bit of loose skin. I'm going to turn to the side so you can see this. It does go around to the back as well. I've got on a Freestyle Libre, as I talked about in a earlier video. I do have some reactive hypoglycemia when I eat simple carbs, so I just keep that on to kind of give me some warning of when it's going to happen. My scar will be, the incision will be all across the pelvic area, and will go, he said, to about right there. So all this is going to be basically taken off, and then the skin of the upper abdomen is pulled down over the lower abdomen. Your belly button stays in the same place. They just make a new opening on top of the skin. So there we go. We'll see what this looks like in a few months. I know it takes a long time for the swelling to go down. Okay, so now for the tummy. I am doing this video in the morning, so my swelling is minimum. I do still have some swelling all the time. Here again, that can take up to a year to resolve, but in the morning it's the least. So I kind of wanted to show you what it looked like in the morning. I'm gonna back up. Hopefully you're gonna be able to see this. I'm gonna pull my pants down as far as I can. So that is what my tummy looks like. Now, as you can see, my scar looks really good. It does go all the way around to the back of my hips, but I think overall it looks really good. As far as scars, I am using a scar gel that my doctor recommended. It's got something called Centylene in it, which I think is a silicone alternative. I am applying it. Up until about a week ago, I was applying it during the daytime and then wearing the silicone scar tape at night. I have found the scar tape just will not stick to my arms. You know, there's such a high movement area. I am able to wear it on my abdomen, so I'm just leaving the scar tape on my abdomen. But then on my arms, I am applying that scar gel morning and night. The left arm, which I talk about in the video, in the axillary area, that scar is a little bit more noticeable. I mean, they're both sides are very noticeable at this point, but that side is a little bit more raised. Looking back at the video from the evening before, I noticed that I had more loose skin and more flab in that area. So that maybe there was a little bit more extensive skin removal or lipo that had to be done there, and that may be why that scar stands up more and is more apparent. But, you know, wearing regular clothes, I think even a sleeveless top, which I don't see myself wearing, but unless you're walking around with your arms up, nobody's really going to see your scars, and especially in the axillary area. That's covered up by shirts, so I'm not worried about that. That's not something I'm stressing out, and I know that it will continue to fade and get flatter. So, measurements. I know everybody is asking me how my measurements have changed. From the night before surgery, my waist, I'm down 3.5 inches. My hips, I'm down 3.25 inches. And then I am actually down 3.75 in each arm, which is crazy. But the arms I had so much loose, flabby skin. I guess that really doesn't surprise me. I am going to put a picture in for the first time in my life. I'm actually wearing short sleeves. Even when I was smaller in like high school, I never wore short sleeves. I always made sure it came down to at least my elbow because I was so self conscious of my arms. And certainly when I was bigger before I had surgery, no short sleeves. Now that I've got the skin removal on my abdomen, I feel comfortable wearing. I've actually got some little jumpsuits, and that's what I'm wearing today. I'll put that picture in. Jumpsuits and short sleeves, and feel comfortable in it. This surgery has done wonders for the way that I was very proud of my progress with my weight loss and with getting healthier, but it's made me more comfortable in this body. So, if you have any questions about my plastic surgery or any plastic surgery in general that I might be able to answer, drop them in the comments below. Any suggestions for videos, I would love to hear from you. I have a video suggestion list that I'm keeping up with that people have asked for. And I hope everybody has a great week. We'll see you later. See you next Wednesday. Bye.